Did you know that a pill many seniors take before bed can spark confusion by morning and may also raise long-term cognitive risk? I'm Dr. Alina Serratia, and today I'm speaking to adults over 60 and the families who worry when memory slips. Recent research reveals that the problem is not always age alone. Sometimes it sits inside the medicine cabinet. By the end of this video, you will know which 9 popular medications deserve a careful review, which warning signs need fast action, and which safer steps to discuss with your doctor. Stay with me, because one category on today's list hides in many over-the-counter products you may already trust. Comment below with every sleep, allergy, bladder, or anxiety pill you take now. I will be replying to each one. Research shows 1 in 4 Medicare beneficiaries living with dementia still receive brain-altering medications linked with confusion, falls, or hospital visits. Studies found that about 25% of older adults with dementia were prescribed these drugs, compared with 22% with cognitive impairment and 17% with normal cognition. An aging brain handles medication differently. The liver clears drugs more slowly. The brain becomes more sensitive. A dose that barely bothered you at 45 can hit like a heavy fog at 75. Let me make this simple. Your brain runs on chemical messengers. One of them is acetylcholine. Think of acetylcholine as the text message system for memory, focus, and clear thinking. Many common drugs block that system. These are called anticholinergic drugs, which means they block one of the brain's key communication signals. Here's what happens when those signals get blocked. You feel groggy. You lose focus. Words hide from you. You forget why you walked into a room. But here's the shocking part most people don't know. In some older adults, that medication fog can come on in hours as delirium, a sudden state of confusion that can look like rapid dementia. Research shows delirium can begin over hours or a few days, while dementia usually develops slowly over months or years. Mayo Clinic warns that some medicines for sleep, mood, allergies, spasms, and pain can trigger this fast confusion in older adults. If a person suddenly becomes more sleepy, more agitated, more forgetful, or starts seeing things that are not there, do not assume it is just normal aging. Now, this is important. Sudden confusion is a medical issue, not a personality flaw. Comment below if you have ever seen a parent or spouse become suddenly not themselves after starting a new pill. If this problem goes untreated, the damage spreads beyond memory. Attention drops first. Then balance gets worse. Then sleep breaks apart. Then confidence falls. Some seniors stop driving, cooking, paying bills, or leaving the house. Research shows cumulative anticholinergic exposure is linked with falls, delirium, and dementia risk in older adults, which is why the American Geriatric Society flags many of these drugs on the Beers criteria. The domino effect is real. Once thinking gets cloudy, missed doses, dehydration, falls, and hospital visits often follow. Let me tell you about Margaret, a composite patient story built from patterns I see often in practice. Margaret is 72, independent, sharp, and proud that she still handles every bill in her home. She started taking diphenhydramine most nights because she woke up at 3 a.m. and wanted a quick fix. Within weeks, she felt slower in the morning. Then she missed 2 appointments, put milk in the pantry, and forgot the route to her church group. Her family worried that dementia had suddenly started. She tried more coffee. She tried forcing herself to stay busy. Nothing helped. The more tired she felt, the more she leaned on the same nighttime pill. When we reviewed her medicines, the answer jumped out. Diphenhydramine, sold in many allergy and sleep products, strongly blocks acetylcholine. She was skeptical because it was over-the-counter. She told me, if it sits on a store shelf, how bad can it be? Still, she agreed to stop using it and switch to a safer sleep plan. Within 10 days, her morning fog eased. Within 3 weeks, she stopped missing appointments. Within 6 weeks, she told me she felt like she got her own brain back. Comment, night Fog. If you have ever felt drugged the morning after a sleep aid, and let me know your age as well. The first thing to avoid is using first-generation antihistamines like diphenhydramine and doxylamine as routine sleep tools. Here's what happens when you take them. They do not just dry up a runny nose or make you sleepy. They also dry up brain signaling, slow reaction time, and raise the risk of confusion, constipation, and urinary trouble. Research shows a 2024 study from Chung-Shan Medical University in Taiwan followed 677,971 people with allergic rhinitis and found dementia risk rose as cumulative antihistamine exposure increased, with first-generation antihistamines showing the highest risk. But here's the shocking part: most people don't know. Many seniors do not realize these drugs hide inside PM pain relievers and cold formulas. You think you are taking one simple sleep aid, but you may really be taking a brain-slowing cocktail. A short-term fix at bedtime can become an all-day fog the next morning, especially after 60. Let me tell you about Edward, a composite patient, age 78. He used a nighttime cold medicine through allergy season. He did sleep longer, but he also became unsteady, irritable, and forgetful at breakfast. Once the antihistamine was removed, his family noticed fewer stumbles and clearer conversation within 2 weeks. The second thing to avoid is relying on bladder antimuscarinic drugs without a medication review. Common examples include oxybutynin and tolterodine. Here's what happens when these drugs calm the bladder. They can also calm the brain. The same receptor they block in the bladder also helps memory and alertness. Research shows the 2023 Life study from Japan looked at 66,478 older adults with dementia and 328,919 matched controls and found prescribed anticholinergic exposure was associated with a 50% increase in the odds of dementia diagnosis. Bladder antimuscarinics were one of the linked classes. But here's the hidden disaster. Seniors often stay on these drugs for years because the prescription gets renewed without anyone asking whether the leaks improved enough to justify the brain side effects. Most seniors do not know that bladder training, timed voiding, fluid timing, and pelvic floor exercises can sometimes reduce the need for these medicines. Let me tell you about Helen, a composite patient, age 69. She started oxybutynin for urgency and thought the dry mouth was the main price she had to pay. 3 months later, she lost words mid-sentence and stopped reading because she could not hold focus. After a full review, she moved to bladder training and a different care plan. Her urgency improved more slowly, but her thinking improved first. The third thing to avoid is treating anxiety or sleeplessness with routine benzodiazepines, such as lorazepam and alprazolam, especially when they stretch far past short-term use. Here's what happens when these drugs hit the brain. They amplify a calming signal called GABA, which can reduce anxiety fast, but can also slow attention, worsen balance, and blur short-term memory. Studies found long-term use in older adults is linked with falls, dependence, daytime sedation, and memory problems, even though the dementia link itself remains mixed. Now, this is important. I do not want to overstate the science. A large USC analysis in 2022 found little evidence that benzodiazepines directly increase dementia risk after adjusting for important health differences. So I am not going to tell you they cause dementia in every case. But here's the shocking part. Even if they do not directly cause dementia, they can still cause medication-induced confusion, falls, withdrawal problems, and cognitive slowing that steals independence. That alone is serious enough. The fourth thing to avoid is stacking sedatives. That means taking lorazepam with zolpidem, or a sleep pill with a nighttime antihistamine, or an anxiety pill with alcohol. Here's what happens when you stack these. The sleepy effects do not just add up. They multiply. Breathing slows. balance worsens, attention drops. Research shows a UCSF-led study following about 3,000 older adults over roughly 9 years found that white adults who often or almost always used sleep medications had a 79% higher chance of developing dementia than rare users. The sleep medicines included benzodiazepines, trazodone, and Z drugs like Ambien. But here's the shocking part most people miss. The issue is not only one bad pill, it is the pileup. One medicine for allergies, one for sleep, one for nerves, one for bladder urgency, and suddenly the brain is carrying a chemical backpack full of bricks. Comment, I'm guilty if you have been doing any of these, because you are about to learn how to fix it. Let me tell you about Robert, a composite patient, age 81. He took alprazolam on stressful days, zolpidem at night, and an over-the-counter PM pain reliever for shoulder pain. His daughter thought dementia was racing in because he repeated stories 3 times in one lunch. After a careful taper plan and a safer sleep routine, his conversations became steadier, and the repeats dropped sharply within a month. You have more control here than you think. You do not need panic. You need a plan. Stay with me, because the next one will surprise you. Number 5 is brown bag medication review. Do you know what happens when you gather every prescription, every vitamin, and every over-the-counter product into one bag and review them with your doctor or pharmacist? Hidden duplication becomes visible. Sedating combinations get exposed. The fog starts to make sense. This simple step can uncover several benefits at once. It can reduce anticholinergic burden, which means the total brain-blocking load from all your medicines. It can catch PM products you forgot to mention. It can reveal when one doctor prescribed something that another doctor never knew about. Think of it like cleaning a dirty windshield. The road was always there. You just could not see it clearly. Research shows geriatric guidance focuses on total medication burden, not just one drug at a time. The 2023 American Geriatric Society Beers criteria warns that cumulative exposure to anticholinergic drugs is associated with falls, delirium, and dementia risk in older adults. The UCLA and Yale team found over 2/3 lacked a documented clinical reason in 2021. In practice, I tell patients to bring every bottle, not just prescriptions. Bring the sleep gummies. Bring the pain reliever with the tiny PM on the label. Bring the bladder medicine. Here's what happens when you do that. Patterns appear in minutes. Expect relief to begin as dangerous combinations are removed, though full improvement depends on the drug and the person. Number 4 is replacing high-risk sleep pills with first-line insomnia care. Do you know what happens when you stop chasing sleep with stronger and stronger sedatives and start retraining the brain instead? The brain relearns when to feel sleepy. Sleep pressure builds naturally. Night waking becomes less frightening. This is called CBTI, which means cognitive behavioral therapy for insomnia. CBTI helps in several ways. It reduces the panic around not sleeping. It strengthens the connection between bed and sleep. It cuts down the urge to reach for a pill after every rough night. It can also improve daytime energy without the hangover effect of sedatives. Think of it as physical therapy for your sleep system. Research shows the American College of Physicians recommends CBTI as first-line treatment for chronic insomnia, and the AAFP says non-drug methods should come first in older adults. That same review says benzodiazepines should not be the first choice for insomnia in seniors, and Z drugs like zolpidem should be reserved if safer first options fail. Mayo Clinic also specifically warns older adults at risk of delirium to avoid sleep medicines like diphenhydramine. Use this practically. Keep the same wake time every day. Do not stay in bed awake for long stretches. Limit caffeine late in the day. If you need medication, discuss safer options with your clinician instead of self-prescribing nighttime antihistamines. By week 2 or 3, many people notice fewer panicked nights. Before the number one solution. Which of these surprised you most? Comment below. Number 3 is asking about lower burden options for allergies, depression, and bladder symptoms. Do you know what happens when you switch from a stronger anticholinergic drug to a safer alternative that fits your condition? You may keep much of the benefit while reducing the chemical drag on your brain. That means less grogginess, less dry mouth, and sometimes sharper focus. The benefits can be broad. For allergies, newer non-sedating antihistamines may be better choices for some people. For depression, older adults often need careful review if they use strongly anticholinergic drugs such as amitriptyline or paroxetine. For bladder urgency, non-drug tools like timed voiding, pelvic floor exercises, and fluid timing may reduce symptom pressure. This is not one size fits all, but it is often safer than staying on autopilot. Research shows the 2023 Japanese Life Study linked anticholinergic antidepressants and bladder antimuscarinics with higher dementia risk in older adults. And the National Institute on Aging says bladder training, pelvic floor exercises, urgency suppression, and limiting drinks before bedtime can help some seniors with incontinence. That gives you a practical path beyond take the pill forever. Use this carefully with your own clinician. Do not stop antidepressants or bladder drugs suddenly. Ask, is there a lower anticholinergic option for me? Ask whether your symptoms could improve with therapy, pelvic floor work, scheduled voiding, or treatment of sleep apnea, constipation, or swelling. Expect gradual improvement, not overnight magic, but many patients feel less mentally flat within days to weeks after a successful switch. Number 2 is a slow, supervised taper for long-term benzodiazepines when the benefits no longer outweigh the risks. Do you know what happens when people stop drugs like lorazepam or alprazolam too fast? Rebound anxiety, tremor, poor sleep, and even dangerous withdrawal can hit hard. That is why this solution must be slow and supervised. When a taper is done well, the benefits can be powerful. Daytime alertness improves, balance often improves. Memory can feel less smeared. Dependence loosens. Confidence returns because the person no longer feels chained to the next dose. Think of a taper like lowering the volume on a loud radio, step by step, not yanking the plug out of the wall. Research shows the 2025 ASAM guideline says clinicians should generally taper benzodiazepines in older adults unless there are compelling reasons to continue. Experts recommend weighing falls, cognitive impairment, dependence, and injury risk against any ongoing benefit. Hebrew Senior Life also reported that prolonged use in older adults remains linked with falls, memory and thinking problems, and dependence. In practical terms, ask your clinician for a taper plan written on paper. Review every other sedating drug at the same time. Add non-drug support for anxiety and sleep. Ask family to watch for withdrawal symptoms, including shaking, sweating, panic, or sudden insomnia. Here's what happens when the taper fits the patient. Early wins often appear as clearer mornings and fewer stumbles, while long-term gains build over several months. Number 1 is treating sudden confusion like an emergency signal, not just old age. Do you know what happens when a new medicine causes delirium and the family waits, hoping it will pass? The person can become dehydrated, fall, miss a serious infection, or get labeled with dementia before the true cause is found. This final step saves function because it changes how fast you act. The benefits of fast action are huge. You can catch a drug reaction early. You can separate delirium from dementia. You can prevent a hospital crisis. You can protect independence. It works like pulling your hand off a hot stove. The sooner you respond, the less harm the heat can do. Research shows Mayo Clinic describes delirium as a sudden change in mental ability that starts over hours or days, and medicines are a common cause. The same source notes that symptoms may include poor attention, memory trouble, behavior changes, reverse sleep, or seeing things that are not there. That is why families need a simple rule. Sudden confusion equals same-day medical attention. Here is the practical move. If new confusion follows a new medicine, dose increase, or drug combination, call the prescriber or seek urgent evaluation the same day. Bring the medicine list. Ask whether the pattern fits delirium, a drug interaction, dehydration, or infection. Watch for warning signs like agitation, extreme sleepiness, hallucinations, slurred speech, or a sudden change in walking. The strongest brain protection is often not a new drug at all. It is removing the wrong one. Here's what makes this powerful. These solutions work together. When you lower anticholinergic burden, retrain sleep, review bladder and allergy treatment, and taper long-term sedatives carefully, the effect is not just additive, it is often multiplicative. You sleep better, think clearer, walk steadier, and make fewer mistakes with other medicines. A simple routine can help. At breakfast, drink water, review your medicine list, and take only the drugs you still need. At lunch, practice timed voiding and avoid unnecessary sedating allergy products. In the evening, use a steady sleep routine, dim lights, and keep nighttime PM products out of arm's reach. Comment routine if you want me to turn that into a printable daily checklist. Please remember the safety side. Do not stop benzodiazepines, antidepressants, or bladder medicines on your own. Always consult your healthcare provider if you use these drugs and notice new confusion, dizziness, falls, constipation, urine retention, or worsening memory. Be extra cautious if you already live with mild cognitive impairment, Parkinson's disease, kidney disease, sleep apnea, or a history of falls. Responsible change is empowering. Abrupt change can be dangerous. You now have the knowledge most families do not get until after a frightening scare. The main problem is not just aging. It is hidden medication burden, especially from diphenhydramine, doxylamine, oxybutynin, tolterodine, amitriptyline, paroxetine, lorazepam, alprazolam, and zolpidem. The main solutions are a full medication review, better insomnia care, safer symptom alternatives, supervised tapering, and rapid action when confusion starts. This is in your control. You do not have to accept brain fog, sudden confusion, or drugged sleep as the price of getting older. Comment one of three things. Review, if you want a medication checklist. Sleep, if nights are your biggest struggle. Or bladder, if urgency medicine worries you. Subscribe if you want senior health guidance with practical steps you can use this week. In my next video, I'll show you the early signs that memory loss is reversible and the ones that need urgent testing. Start today, not someday. If this video helped you, share it with someone who needs this information. You might save their life. Beware. 9 popular medications that can trigger rapid dementia after 60. Dr. Senior Health Tips.